We should.
No,
Asa. You don't have like a gynecologist joke.
No, I don't have a uterus joke.
I'm sure whatever jokes those
No, you guys, I'm talking about like those funny jokes, like
The birds and the bees.
more like what did the uterus say to the cervix when
Yeah.
the man came in or something like that.
The man
Like
came
they're not jokes like that. You people, no one here is making it as a
No, it's
comedian
okay.
clear.
No, it's fine.
I mean, I would be fired, but I've always wanted to say Dr. Chomba at your cervix.
Oh my god, that is so horrible.
But at least he didn't say it. He wanted to.
Just
He wanted to. Oh wow. I don't. You know what? I feel like if I was very like scared, like very frightened, and somebody says that, I think first I would look at you, I would laugh,
I would
then
laugh
look at
too.
you again and glare at you and say, "How dare!"
Exactly.
I think I would just laugh. Unless I was like really sick, I would just laugh.
Okay. So, yeah, welcome to At Your Cervix episode. My name is Anne Holland, and yeah, I am a feminist talker.
My name is Tendai, and it's looking like a mayapa because
Real.
I've been doing a lot of talking of late, but yeah, that's that.
A feminist yappa.
Real. I'm Hazel, feminist yapper 2.0.
Yeah, certified.
And a Gen Z researcher.
Why does it always have to end with me? I'm Arthur. I'm a doctor in obstetrics and gynecology.
Dr. Chomba.
Dr. Chomba, if you ever meet him.
Oh, my word.
Okay, guys, so welcome to our episode.
Welcome to the F spot.
Okay, Arthur, I wanted to ask, right?
Yeah.
Let's imagine a young person comes to you.
Mhm.
They're probably in their first year of university. Everybody around them is having sex. They are ready to have sex, but they're terrified. Terrified of getting pregnant, terrified of STIs and all the issues that come with that. And they come to you, Dr. Arthur.
Yeah.
You know, youth-friendly doctor, and say, look, I'm about to start my sexual journey, and I've heard of so many things. I've
Yeah.
heard of contraceptives. I've heard of, STIs. I'm afraid of catching this. I'm afraid of catching that.
Yeah.
And they're like, explain it to me. What's the best possible way that you as a doctor can handle that? But even something that parents or adults and guardians can sort of like take from it. You know, when we start with like contraceptives, what even is that? How do you explain it to them?
Okay. So with contraceptives, there are different types, of course. Most people think about contraceptives as being the pill. Oh yeah. So morning after, they'll think of it as a contraceptive, or just like taking your 28-day pill. They'll think of that as the only type of contraceptives. But the contraceptives are different forms, and there are those that are hormonal, those that are non-hormonal, and then there are those that are permanent, non-permanent. So it depends on what this 18-year-old wants. And then we're talking about those that are barrier methods as well. Okay. So we can categorize them. I don't know if we should, that's in discussion, of course, with either them alone or with their parents, depending on how the situation is. But usually, so they're categorized in barrier contraceptives. There's hormonal, so the implants, these are subdermal, the ones you put on the skin, inside the skin, sorry. You've got the ones that you put through the uterus, okay? And then there's the ones that cover the cervix, for example. Okay, so those ones are barrier methods. So the barrier methods is just a condom. There's a female and male condom,
Okay.
obviously, the most common ones, readily available everywhere, free to access in every hospital, yes. And they're given out even in some schools, by the way, in some schools. And then you have the ones that are subdermal. So these ones, we put them under the skin, okay? They're under the skin. They're usually there to just stop pregnancy from occurring. And then we have those ones that are rings that go on the cervix, the sponge that stops spermatozoa from sperms from going through the...
He just used the scientific word. No,
Yes.
What's that word?
the sperms from going inside the cervix into the uterus, and then that can cause a baby. Then you have the natural method, which is where you get to notice your body temperature going up, and then you notice, obviously, most likely I'm ovulating. When the mucus changes, I'm probably ovulating. And there's also use of a calendar. Okay, so use of a calendar, that's also a natural method. And there's also
Pull out.
yes, that's one of the natural methods. One of the most common natural methods. Yes, so there's pulling out or withdraw, as we call it.
Oh. Might be.
Yes, withdraw, as we call it. And then the most common contraceptives, the safest of them all, abstinence.
Mm.
But I feel like it should be removed. It should be removed as a contraceptive.
Why so?
Because people are going to have sex regardless.
Obviously, yes.
Right? They are. And also, I think if we're going by religious standards, wasn't Mary abstaining?
She was.
Right? Right? And there's that movie, Jane the Virgin. So you never know. You have to be safe. You have to be safe.
Always.
You know what? I think I understand like the work that's been done around ensuring like young people get access to contraceptives and things like that. But I would like to know from your perspective, as working in the medical field, how often and I'm not saying this is like something wrong with the doctors, but mostly because of the system and fans. But how often do you sit with young people and say, okay, let's sit down and see best possible contraceptive for your body, Because I remember this one time I went to a clinic, right? And this girl had come, she had gotten like an IUD and she's like, I've been bleeding for the last 3 months, like nonstop. And the nurse was like, 3 months, I can't remove it. So she wanted to remove it. She's like, I can't remove it. 3 months. What's wrong with you girls for nowadays? You don't even understand how hard it was for us. Like, she just gave her a whole speech and she let that girl go. And in my head, I was thinking, as somebody who works already in this field, I probably know that this girl probably already has like very heavy periods.
Yes.
And this has just like worsened it. And if somebody had sat her down, they would have helped her pick the right contraceptive for her and not recommend a copper IUD button.
Oh, yeah.
Yeah.
So when it comes to contraception and the side effects and which ones we pick, it depends. So let's say, for example, like in the case of an 18-year-old, she's got 4 years of uni to go, and I'm sure that 4 years she doesn't want to get pregnant. So most likely would prefer a long term. So would give her options of the long term ones, both hormonal and non-hormonal, and then would have to discuss with her, okay, when it comes to, so there's what we call a MEC will, an MEC will. People should look it up. It's a recommended will by WHO before you make a decision on what type of contraceptive you're going to use. So, and this is for across all the women, right? So if they're obese, if they have, they've got medical problems, so you have to check their medical background as well. You have to check, like in this case where you've given an example of the young lady who had prolonged periods, because usually they stop. Once you remove the contraceptive, that side effect usually stops.
Yeah.
So yeah, you have to go through a vetting process before you can start the contraceptive. Yeah. Unless it's, of course, it's like, because we do know that even sex workers need contraception as well. And because their work depends on it, you can't tell them to say, okay, first we're going to assess you, take these labs, and then you come back after so often, because for them, that's not going to be a very great opportunity, if I can put it like that, to go and then come back, because they need it, right?
Yeah.
So it's kind of, it's different. So with access, it takes learning, right? So like you have said, it takes learning and continuously have to learn. So hopefully even some medical personnel actually hear this podcast as well, and then make a decision based on the things that we're talking about now, because then changes not only the perspective of the person who's receiving it, but also the person who's giving it. Yeah. So there's a lot of unlearning to do.
Okay, that's really good to know. So earlier you said the word spermatozoa, and it had me thinking of like all these medical terms we come across. And I recently came across dual protection.
Okay.
Yeah, so I just wanted to know what exactly that is, because I heard you're supposed to have dual protection at all times. So I don't really know what that is.
That's a great question.
Mhm.
So dual protection is where you use two types of contraceptive.
Mhm.
So now, most of the ones that we use, most of the people are afraid of getting pregnant,
Mhm.
but not afraid of getting STIs.
Oh,
Yeah.
that's true.
So, so when we talk of dual contraceptives,
Mhm.
we're talking of a contraception that has. So you use both. You use two contraceptives that will, one, either stop pregnancy and one that will stop STIs. Condoms do a great job at both, right?
Mhm.
But then there are those who have like in a discordant couple, for example, right?
Mhm.
The discordant couple is a couple that has one has HIV, the other one does not have,
Okay.
and then they also don't want to get pregnant at that time,
Mm.
right? So they would want to use. Sometimes the woman would probably prefer having long-term contraceptive that will stop babies from coming, but then also will stop the transmission of a disease, for example. So a condom and a morning after would be ideal, right? Yeah.
I just remembered when you were mentioning the contraceptives, I didn't hear vasectomy.
Well, I didn't mention bilateral tubal ligation either. So those are permanent methods. I think I was more biased to the 18-year-old. Yeah.
Yeah.
Mm.
But then there are permanent methods that we use for sterilization. Right? So there's no so with a vasectomy, this one is complete contraception.
Is it reversible?
Well, I've heard that some places do it, but it's very difficult. Once the tubes are gone, it's very difficult to replace that.
Mm. So you said because the person's 18, you didn't think about permanent methods. What contraceptive methods can we talk about when we're thinking about young people?
Okay. So with young people, I would want to, first of all, avoid using something that is hormonal long term.
Mhm.
Yeah. Because that disrupts the whole cycle over a long period of time. So would prefer using something that is non-hormonal. So for example, for the IUDs, there's two forms. There's the copper, which is non-hormonal, but it's spermicidal. So it means it kills off the sperm. And then we have the levonorgestrel, which is like the one that is found in the morning after pill. But this one is inside the uterus, right? So would offer them that. So, and actually that's my preferred method of contraception for women because it doesn't give side effect, doesn't give off side effects such as mood changes, because then the cycle just remains the same.
Which one is this one?
The copper.
Oh, the copper one. Yeah.
The copper doesn't.
I had the
yeah.
copper for a year and a half.
Yeah, doesn't give much. Unless your
No.
experience was different.
For me, no. It didn't change anything, and I easily get affected by like hormonal stuff, right? So it didn't. The only thing it did, it gave me the worst period pains of my life.
Yeah, my
I've
friend
never had
actually
bad
also
periods
said
like
that.
Yeah.
So
They had horrible period pain.
So that's the one side effect. So the period pain is that one side effect. So usually what we do is we test out these contraceptives depending on the person who has them, because one effect for one person might not be the same for another. So yeah, so we do that. We do a test, and then if that doesn't work, we come back, we remove and try another one, because you can try more than one form of contraception. And then we've got things like the cervical ring. So this is a ring that goes right on the cervix. And these ones are non-hormonal as well. So they just close off the cervix. When it's time for your period, you just remove it. There's also a cervical cap. You just place it there. It's time for your period, you just remove it.
So do you do that yourself, or do you have to go to like a medical facility?
No, you can do that yourself.
Really?
Is it like a menstrual cup?
Yes. Your cup. Just put it there. And it is like that, but its job is to just tighten up the cervix so that nothing goes. It's also considered a barrier, but does not protect from STIs.
But I think that's when, like, it's so funny. I remember, like, a few years ago, a friend of mine was, like, very worried that she was pregnant, right? And I think, like, we started laughing halfway through because she was like, I can't believe I'm more worried about pregnancy than STIs, right? And which is, like, the truth.
Yeah.
And, like, I think we said it in the last episode of how for us who grew up during the like HIV and AIDS campaign era,
Yeah.
like it was this very scary thing to the point that even the idea of having sex without condoms it wasn't just like a girl thing alone, but even the guys would just be like,
Yes. Yes.
because
Not today.
right. So we grew up within that era, and I feel like in the last few years, granted, like that era also came with a lot of stigma,
Mhm.
and even to today, people are too afraid to even get tested or even get ARVs because of that entire stigma. But I feel there's like, what other STIs are there that I feel like young people should be very aware of that they don't really, consider. We're out here just doing the. I mean, I don't even say we. But yeah, people are out here just doing the most and without any form of like proper education or understanding, honestly.
Yeah.
So if you could break it down to like just the most common ones that people should be wary of.
Okay.
Sorry, just before you answer, can I quickly cut in?
Yeah.
I just wanted to find out how long someone should use a contraception for before they accept that it's not for them.
Oh, as soon
Because you
as,
said we can like
Oh, yeah.
try.
as soon as possible.
Mm.
Yeah.
So let's say, for example, because we usually put the contraceptive, like usually it's right before ovulation or right in the mid-cycle. So
Mhm.
within 2 weeks, you might know that this is not for me.
Mm.
So if it causes excessive bleeding, you know this is not for me.
Okay.
If it causes extra cramps, you know this is not for me.
Okay.
Yeah. So it depends with the type of side effect that you have, and then we can deal with that. For some, like for example, they would say the last 3 months I've been having mood changes. So this is common with oral contraceptives, the combined ones where you take one pill every day. So usually they'll tell you I'm having mood changes. I am not having my sex drive is quite low, and that defeats the purpose of having a contraceptive anyway.
That's true.
So it depends on the type of contraceptive they're taking, and then we tend to fix that. For the STIs,
Yeah.
so most of them are really, really, really asymptomatic. So that means that they do not give off symptoms. So you not feel pain, you not feel any form of fever, headache. Those things do not show up. I'll give you an example. HIV is the most common, right?
Yeah.
Mhm.
Yes, most common. And after infection, you only start seeing the symptoms 10 years later. So testing must be frequent. Yeah, that's the most common one. Of course, we ignore it. When we think of STIs, we think, oh, okay, syphilis,
Chlamydia.
chlamydia. But then we forget that HIV is the one that is the most common one. And symptoms take up to 10 years to start showing up. So, but we do have chlamydia, which is sexually transmitted as well through vaginal, anal, that one oral can be transmitted. Got gonorrhea.
I'm sorry, everybody's no,
We are all shocked.
but no, that's why they're like, I know there are those like dental condoms.
Yes.
Yeah.
Yeah?
Yeah, they're dental condoms.
How do
that
those
you-
work?
They're like literally you put them, is it around your tongue?
Yes, around your tongue and around the mouth.
The
So
mouth,
just-
yeah.
Hmm.
They're like little elastic,
Yes.
sort of like latex.
They're literally just condoms for the mouth.
Yeah,
Oh.
condoms for them.
Okay.
Yeah. Got gonorrhea, which also is transmitted the same way.
Mhm.
You have human papilloma virus. This one can be transmitted just by kissing. Okay. Kissing,
So you shouldn't be kissing.
Yeah. So how do we choose who to kiss? Because you can't tell by looking.
No. So what I usually encourage people,
Mhm.
especially the teenagers that usually come, because most of them will come with questions. So we usually tell them before you get a partner, you get tested. So you
Mm.
get tested, get your partner tested. right?
Before kissing.
Yes.
People kiss, like you kiss,
Yeah.
like
Before kiss at the club.
people. No, in fact, right? People kiss
Even
at
after
the club.
COVID.
Especially after COVID.
Especially after COVID, because people are like, you only live once.
Yeah.
But I think it's also the idea that who's kissing after the relationship has been being it.
Yeah.
Yeah.
People need the kissing for the relationship to
To
happen.
start, yeah.
So how do they navigate that? Ish.
Well, yeah, it's quite difficult, but obviously after the kissing, we can get tested. And usually these ones are treatable.
Okay.
Yeah. So these ones are quite treatable. So walk into a facility, come to get tested for this. Usually they'll just probably draw your blood, do a vaginal swab, and probably do a penile swab as well for the gentleman. Then you can have your results in a matter of hours.
Okay.
Really.
What about, I know there's like what's this again? That for the, is it HPV?
Yes.
They encourage young women to get tested and also get the
vaccine.
The vaccine.
Yes. So for the HPV, which is the human papillomavirus, yes. So this one is usually, so it's the one that causes cervical cancer, right? Yeah.
Really?
Yes. It's one that causes cervical cancer. So usually this one is predominantly on the male penis.
Okay.
So if a test is done, okay, so that's why we encourage men who have multiple partners to get all their women tested, because sometimes what happens is you have one man having this HPV that he gives to one woman, then goes and gives it to another one. Or if the woman has multiple partners, she'll get it from, so the man, and the next man will get it from her and give it to them, just like that. So usually, cervical cancer screening is very, very important, and we encourage that.
How often do you see young people coming in?
Not so often.
Yeah.
Usually it's when they have symptoms like, no, I'm having prolonged periods and so we want to test. Or those ones who say tested for pregnancy, then they would come for their tests.
Okay, I feel like, not that I want to like scare people, but like what type of, because sometimes we hear of these things, right? Somebody will be like, cervical cancer, and they won't take it seriously until it actually happens. So what are like, how does it really affect your life? On top of the fact that it's cancer, but how does it like affect young people's lives so that they take it a bit more seriously?
Okay. So when we were growing up, there was the idea that cancer is usually, and even when I was in my first years of medical school, the idea that cancer was for people above 40.
Yeah.
So every form of cancer, probably above 40. But now we're seeing it in 20-year-olds, right? We're seeing it 20-year-olds, 18-year-olds. So of course there are stages, right? The stage 1, stage 2, stage 3, and then stage 4. Stage 4 is the last stage of the whole disease, and there's disease in the lungs and everywhere else, and that's like the end of the life, right? The end of the lifeline. But in stage 1 and stage 2, even stage 3, these are treatable. And so these are treatable. And stage 1, even if they do find the HPV during a cervical cancer screen, it's treated almost there and then. Yeah. And so I'd encourage everybody to walk into a cervical cancer screening.
Yeah. And sorry, the vaccine, it's up to what age?
So the vaccine, if I'm not mistaken, up to 11.
From 11 years old?
No, up to 11.
Sorry, what? It's
so
only
the vaccine is for unexposed individuals. So 11 years.
I think they start as early as 9, yeah?
Yes, they start as early as 9 up to 11. So usually that's the age group, the range.
Would you do it for your daughter today?
Yeah, I'm actually about to do it. I was waiting for her to turn 9. So in the plans in a week or so when schools close.
Good.
You said most STIs, some STIs are asymptomatic.
Yes.
So is there any symptom that's like that we can look out for, that anybody can look out for? Any itch?
Usually itches, not so much, but what do you call it? Candida does have an itch. And it's not a sexually transmitted.
Yeah.
So most people would mistake that for being an STI.
And Candida is?
Oh, sorry. So Candida is a yeast infection.
Thank you.
Yes, infection. Okay. So that would be considered. So most people would think that is an STI, but it's not. And then, so for the ones you'd have, discharge is the most common symptom. So there'll be different colored discharge, yellow or greenish, and sometimes just a foul smell. Then you'd know, oh, okay, maybe I do have an STI.
Are there more severe symptoms? I heard about this one STI where you froth at the penis or vagina, and I feel like that's the scariest thing.
Yes.
Yeah.
Yes. There's those, and they are quite, if it gets to that point, then they are quite severe. And usually when they get to that point, it's more than just one STI.
Really?
Yes. Usually more than one STI.
Do they have long-term effects when they stay for a while?
Yeah. We're talking about an area that is sensitive to changes in the cells there, because it's used for the function of the vagina is for, and the penis is for, okay, it's for childbirth, yes, but it's for the process that leads to the childbirth. So it's for
Yeah.
the sex. So it's always going to be having these cells that are constantly just being eaten out. And once those cells get eaten up, okay, get eaten up, we call it a metaplasia. So it changes. So the lubrication then changes. The need for the sexual mood also changes. So everything just goes a different way.
Another thing that's scary for me, I think, and for other women is you will see or you read or you hear that when you're looking at STIs and symptoms, some of the things you see for women is you see, no, there's no symptoms, or it will lay dormant for years.
Yes.
And whereas for men, most likely, like it does show up. I don't know which are some of the most common STIs that hide in women or in female-bodied people.
So for the ones that are very common, right? For the ones that are very common, we have so the ones that are very common, we have chlamydia. Okay.
Yeah.
Yeah, chlamydia is one of those that is very, very common, right? And usually you'd see maybe a yellowish or greenish discharge. That's the one. But then the reason why it's like that, it's because most of these will just, so the cells in the mouth, okay, the cells in the mouth, the vagina, and the prepuce of the penis are the same, right?
The
And
what?
the head of the penis.
Yes, please.
I beg your pardon.
Draw you back every time.
So the head of the penis are the same. So that's the reason why we encourage men. That's the reason why we encourage men to get circumcised. Right?
Okay.
Yeah. So because once they're circumcised, that whole process gets, so that those cells get how do you say? Change. Yes, they change. Yes, they change. And then that makes the transmission less.
Okay.
So that's why we say that these ones get transmitted even via oral sex as well.
Ah, I see.
So with men, it's easy to see because they hold their penis when urinating. Women, it's different. Yeah. Unless you're in the mirror all the time and
Yeah.
So it's not.
That's actually. I think, I don't know if you guys have any other questions on STI. Talk about uterine.
I do have a couple of questions actually.
Okay.
So, are there any preparations that should go into STI testing? Like, don't drink alcohol 24 hours before or whatever. You say they're going to draw blood and stuff. So, is there any preparation we should have?
What should I know?
No, you can drink your alcohol.
Noted.
Yeah, you can drink your alcohol. So usually what we do is we tell you, for example, not to urinate an hour before.
Okay.
Because you don't want to. So let's say, for example, if you don't want the idea that you're going to wipe afterwards. So yes, urinating causes wiping. So we want to avoid that. Yeah, because just in case we do a swab and then we're swabbing out what was wiped instead of what is naturally there, then we'll tell you to come ready. That's a one thing. Come ready. Be psychologically ready. Because most likely, obviously, there's going to be undressing. So you come in something that's comfortable for you. Okay. Come in something that is comfortable. So be aware that you're obviously going to undress. If you're not comfortable with the person who's doing the examination, you can ask for another person. So if you're not comfortable with male doctors, you can ask for a female doctor. Or you can ask for a nurse to do it for you. So there's those processes that you have to do.
Do they use that pap smear thingy for STI testing? What's it called, by the
The
way?
speculum.
That thing is so uncomfortable.
The
Yeah, I
worst.
hear so.
Speculum.
Oh my god, it's literally so
Are
uncomfortable.
there actual
I feel
conversations
like-
happening around pain medication for that?
Yes and no.
Yeah.
Okay.
So you can take because you can take medication because the idea is if it's so painful, obviously you need
Yeah.
analgesia.
Yes.
But once you take it out, usually it's the pain goes away. But you can always ask to say, I'm having pain. Can
Mhm.
I have some pain medication?
But I feel
And they'll
like
give you.
some nurses would just be like, "Ewe."
They wouldn't. I don't even think they would give it to
And I
you.
feel- You know the thing that I've found? Are you at a teaching hospital?
Yes.
Okay, why do you do? Like, I understand that you're trying to teach people, but I feel like I have never been asked, like, are you comfortable with our students,
That's
right?
so true.
Like the day I went to remove my IUD,
Same. I
there
was
were
about
like
to say.
6 nursing students, and I'm open wide, and they're like, "Have you seen the cervix?"
Yeah.
And I'm just like, I did not
Excuse
consent
me?
to this.
Yes, that was me as well. I think there were about 10 students. Some should have been like med students, nurses. And then it was lost and they were looking for it. And I was up there and I was in so much pain. They were trying to find it for a good like 15, 20 minutes. And then I think when the doctor was just like was tapping out, he looked behind and like decided, okay, I could probably give one of these students like a turn to like see. It was really something. And then I was like, no, I'm not going to do this anymore. Let's really just finish
Yeah.
this in the operating room. Yeah.
Yeah.
So it puts me off doing teaching hospitals.
Yeah, I do get that. And that's something that we continually keep on discussing over and over and over again. So the one thing that I consistently advocate for is consent.
Yeah.
Consent is very important. So I always tell my students, how would you feel if you're dressing and someone is watching you dress?
Yeah.
Or how would you feel if before anybody just comes and touches you? Because it's inappropriate touching without consent.
That's
yes.
true.
Any physical examination, even in a medical sense, okay, not just going to come to you and then start asking you to just like undress. No, it's so that's something I would like to apologize for. Okay,
Thank you.
I'd like to apologize for that. But we always advocate for consent first. Because what we usually do is we feel there's an exam. So in an exam, there's a part that says treated the patient, asked for patient's consent. And if if that portion is skipped, you're failing.
Oh, okay.
Because I was doing like an echo, right? And are we ready to enter the uterine thing, right? Okay. So I missed my periods, right?
Okay.
For like maybe 4 months. And everybody kept laughing. She's pregnant. I'm like, guys, I'm not pregnant, right? And so to me, the only thing I was thinking of is that for a very long time, every time it's cold, my periods would delay. And sometimes I'd even skip like 2 months. So for me, it was like normal. And so when I got on the IUD, my periods became extremely irregular. But then like when I removed it, then this one random time, I missed it for a month. But I'm thinking, okay, I just came from an extremely cold space and I've been traveling, so this makes sense. By the time we're entering month 3, everybody's just like, you know, like I would go to hospitals and the first thing they'll just say, "You're sure you're not pregnant?" I'm like, guys, I've tested. I'm not pregnant, right?
When was your last period?
When was your last period? I'm like 3 months ago. And so every doctor I went to, specifically the men, right? They kept saying, and then when they would like check my blood pressure, it would like be extremely high. And so they're like, you have very high blood pressure.
Yeah.
So they would do like the whole blood testing. So they would even do the cholesterol, whatever. Everything was looking normal, except I had like maybe extremely high platelets.
Okay.
And I've forgotten what other thing was in there that gives you like, is apparently marker of stress, right? So they kept saying, you're stressed, that's why your blood pressure is high. They would give me blood pressure medicine and my blood pressure would not go down, right?
Yes.
It would still not go down. So now one doctor like recommended I do is it EKG, echo thing. I have never been so traumatized in my life by a test because they didn't tell me. I think that's like, it's important to tell people like, do you understand that we're going to be moving your breasts around? were going to be like pressing things, and there was no form of like consent around it. They just said remove your shirt. I mean, I was thinking they're doing stuff at my back,
Remove your shirt.
right? And I removed it, and it was just, and the guy apparently kept seeing like an irregularity or something. So he had to call another person and another person. And there are these 3 men now who are moving my breasts around. And I'm just like, I'm literally looking up. I'm like, I am so traumatized right now. Then I take them, like all the male doctors keep giving me all these meds and whatever. Then I go to this like female doctor who I had found because the doctor who had requested the EKG thing is gone. And she looks at it and she's like, I'm like, the technician guy said they saw an irregularity or something. And she's like, no, I think you're too young to like have
that type of...
Yes. And so she was like, I actually think you have PCOS. I'm like, no, I don't have PCOS. I have normal periods. I have normal one. And she's like, do you take the morning after a pill? I'm like, no, I'm a long-term contraceptive girl. And I was like, for a very long time, I was on like non-hormonal contraceptives. And she's like, yeah, even that. She was like, I think you have PCOS. And she was like, I want you to go do a hormonal testing. Go test for like insulin, sugar, and stuff like that. And I was like, in my head, I was like, she doesn't know what she's talking about. And I left, right? And I continued with like the meds the doctors were giving me until I think I was actually out of the country. And then my period started. I'm like, see, my periods are here. Everybody was saying I was pregnant. Then I said, bleeding in a way I've never bled before in my life, right? And I was just like, okay, this is just maybe that one day thing. I took meds, then I was on a plane. Have you ever stood up on a plane 5 times to change? I have never been so traumatized in my life because the moment I just arrived, I went to Tendai, I'm like, Tendai, I need a doctor. I'm like, I think I need to go see a gynecologist. And that's how I went. And literally 3 minutes with that gynecologist, she was like, you have PCOS. I'm like, no, I don't have PCOS. She's like, in my head, I'm even irritated. You haven't even tested. What do you know? Until like after going through so many doctors, some doctors were like, we don't even need to test you. You just need to tell us your symptoms. And it's there. And I think that's like, those are conversations that people don't. I remember the doctor was like, you should go lose weight. Go and exercise. And I remember feeling very offended, right? I was like, this man, what does he know? This is fat shaming. This is what and what and what. And I feel like he was right, but in a sense of like, they don't tell you that with PCOS, you won't lose weight. You guys have been going to the gym 4 months. I haven't lost weight. But my periods have stabilized. That's the one thing I can say. I'm like, for once, I even have like a short cycle. I'm like, okay. So maybe this is what they should be saying. Go to the gym so that it stabilizes. Because for the losing weight, you'll be depressed because you just be out there running 1 hour.
It's also like, it's very concerning how we do not speak about these uterine conditions and diseases. I think the first time I ever heard the word fibroids, I was in high school and I was at a Catholic school. So there were stories that go around. If you were in a Catholic school, you heard stories around, the nuns have to go and get operations every few years. Or some stories say, no, they're terminating, no, they're doing. But there was a conversation around most of the nuns go and get operations. So after a few years in school, someone said, I heard it's something called fibroids. I was like, what's that? So it's something that happens when you don't have children. So if you go a long time without having children, you need to always So that was the information. So I was just like, okay, so fibroids, nuns, because they go every 2-3 years. If you're not having children, you need to go and have. And that was the last I probably heard about fibroids till maybe even like 10, 15 years later when I heard, this person's unwell and this is someone a bit older. What's wrong? Fibroids. I'm like, I've heard this word before. But then now the actual realization of like what they are and how common they are, because then people, like the way people would freak out. I had someone I worked with who refused to get medical help because of the fear around fibroids, just the notion of the operation. And it was so bad because she would pass out during working hours. She would pass out. She tried herbal medication that would make the passing out worse. And, and I was thinking, oh my God, it must be really bad because if someone's not wanting to go and get an operation, like people make it seem like, it's such a huge thing that is very, very life-threatening, and it's very serious. But it's also because these conversations don't start when we are much younger. We feel like I have to deal with this when I'm 50, or I'll have to deal. And before you know it, life catches up quickly that your friends are the ones who are now saying, oh, I have fibroids. And you're like, we're not yet there. So yeah,
I feel like I've had the opposite experience. I heard about fibroids when I was so young. Maybe I just used to eavesdrop a lot.
Yeah, you probably used
but I used to hear about a lot of women having fibroids. But I didn't know. All I knew is that it's like a bunch of flesh in your stomach.
Yeah.
I'd be like, what's going on? Why does everybody have flesh in their stomach? But I knew a lot of women have fibroids from like a really young age, maybe 10, I think.
Really?
Yeah.
But it does make sense because you are quite younger. So it does make sense that you started
I
hearing
thought you were going to
about
say
it.
I'm quite nosy.
That's too. But yeah, it's concerning how these conversations are not happening as often as they should, because
that's true.
we've started the conversation around cervical cancer, which is happening everywhere now, which is a good thing. But there's so many other things.
So especially in the, I don't know what happens usually, but we've been encouraging people, especially in the communities, right, to do, even if it's a yearly checkup. So whenever these women come for cervical cancer screening, for example, we'll tell them to do a scan for the uterine scan as well, to check for the ovaries. Okay, so usually the reason why it's like that is most people would shun away from things that are, because it's like, it's personal, it's my thing. This is for me. I'm the only one experiencing this. Yes. But there's actually power in community, Yeah. The same way we have this idea to say, let's kick out the same way we have this idea to say, let's kick out cervical cancer, right? Or HIV.
Yeah.
There should be an idea to kick out fibroids, right?
Yeah.
But the thing is, fibroids are a natural process.
Yeah.
And they are benign. So benign means they're non-harmful, right? They're non-harmful.
Are they really non-harmful?
Really?
Until
They're
he's ending there.
they're non-harmful until they start to cause symptoms, right? So usually, like you said, we're using an example of nuns, right?
Yeah.
So usually it's as a result of the estrogen that is produced by the body, right? So the estrogen and the uterus, they want to get excited. Let's have some fun. Yes. Yes, let's have some fun. Let's party together. But then the thing is that there's also going to be a point where when there's no counteracting hormone. So in this case, it would be a human chorionic
In English.
HCG.
Yes.
Okay.
Oh, all of that for HCG.
HCG, this is a pregnancy hormone.
Yeah.
So once the
know
body
that.
gets aware that, there's this, the uterus can actually do something other than just have fibroids. So fibroids are usually there, they're common, they're small, they're non-harmful until they become nuisance, right? So depending on how much estrogen is produced, then the HCG, if there's no HCG at any point in the lifetime, they'll not usually notice that, this is happening. But also it happens in women that also have children.
Yeah.
But
I know my mother had them.
Yeah.
So if
I
they do not
recently
have
found
children,
one sitting somewhere there.
yeah. So if they don't have children for how old is your last one?
9.
Yeah. So it's been 9 years.
Yeah.
9 years of no exposure to so it becomes a bit of a concern. And you'd notice that with women that are postmenopausal, right, you rarely see this because they become more common with estrogen production.
Okay.
And then coming to Anita's diagnosis that was made, this is a clinical diagnosis. So we just make it on just symptoms. So how is the period? No, it's not regular. Okay. Not regular, but does it come heavy? Yes. Okay. Does it, do you have any heart palpitations sometimes? Okay. Are you gaining weight? How's your blood pressure? How are your sugar levels? So just by knowing that, you get to know exactly what the diagnosis is. right? And then you have things like endometriosis, which comes also, which might also be attributed to the PCOS, because sometimes they might be in isolation, and sometimes they might occur together.
At the same time.
Yes, at the same time. So in medicine, we say we study the diseases separately, but a patient can come with malaria and HIV. It's not like, oh, I'm just treating the malaria. No, so they do come in combination. And endometriosis is where you have, because the uterus has lining, the one that sheds. This one that sheds is implanted in the muscle part of the uterus, and that's painful. It causes excessive periods, and that's where the excessive bleeding comes from.
And the pain.
Yes, and the pain.
I find that's what happens,
you know.
But for me, it's like the moment, because I was like, the excessive bleeding was so bad, they had to put me on like, I was bleeding for a month straight. But they were saying it was because I wasn't having periods, so like my uterine lining was just growing and growing and growing. And so they had to put me on these non-hormonal meds that were godsend, honestly. Like stopped the bleeding. But then it's really the exercising that has like, you know, like since the exercising, I complete, like it's on the dot, guys. Like my cycle used to be 30 to 33 days. Me, for once, I'm under 30. Like it's an actual shock that for now, like my periods are so accurate that they will start within 24 to 28 days.
Have you ever thought about how would hear stories of women who would bleed for a month or 2 months and it would be attributed to like witchcraft?
Yeah.
Or this woman was dating someone else's
husband.
And what? Like it's only now that I sit and I think about some of these things. Because they're like, oh, if you do this, if you're being promiscuous, you're going to... Yes.
Yeah.
It's crazy.
They still happen even up to now.
Really?
Yes.
I had a friend who had a period for 3 straight months, twice. Like, so for 6 months, basically, she had 1 month to rest and then 3 months again, every single day
I've
for
seen
3
people
months. And nobody said anything like
going
that.
to the mountains for a few weeks.
Oh, no.
Yeah.
When you think about it,
And
honestly,
then people
like,
want
the myths
seek
around
medical
it,
care.
because me, when I used to like miss my periods, specifically when I was younger, right? Because I would start, and for me, my periods have always been affected by everything around me. I'm stressed. Even how I started my periods, I was writing my grade 9 exam on Monday, Friday, right? Like I've like stress when I go to new places, when it's cold. And I would always attribute it to like being scared of like, my spiritual husband impregnated me. So when my periods haven't come, and you're too afraid to talk about it.
So I know this is a podcast that will be heard around the world, but in Zambia, we have attributed a lot of things to being a Christian nation.
Yeah.
And so because we've attributed ourselves to being a Christian nation, anything that is not explainable becomes something spiritual. And sometimes we say that, don't get me wrong, I'm a Christian, I believe in. But there's also a point at which you have to know what is spiritual versus what is knowledgeable. Right? Yeah. So there's this misconception around and this is not just in Zambia, this is everywhere. There's this misconception about women being she's just in a mood. She's just being hormonal. Just leave her. It's one of those things. But for people that are in a field that I'm in, okay, so like I'm in obs and gyne, and so that we know that the uterine cycle, okay, gives you different types of moods, and you have to. So I'd encourage the men, especially the ones that are listening to this, know your woman's cycle. So if she's being moody, okay, and it's a thing, right? So we can't ignore that. If she's being moody, it's not because she wants or she just woke up that day. I'm feeling like I want to fight today. No, and don't feel like fighting. It's the body, and you can't control it. Okay, even men have that once in a while. They just have that blue day. Just have that one blue day where they just don't feel like anything. But for women, it's a constant thing every single month. So you know, okay, my period is about to come. Okay, I'm going to have either PMS or I'm going to have premenstrual dysmorphic
I'm going to hate people.
disorder. Yes. So today I don't feel like talking, guys. Leave me alone. I don't want to be in the office. Today you're shouting the whole day, and that's normal.
And
Today
that's so hard to explain. Like,
Yeah.
oh, I'm in a bad mood because I'm on my period. Like, they'll be like, oh, grow up. How are you still doing this to this day? Aren't you used to having a period by now?
because the thing is, it's not just the brain that gets affected.
Mm.
So the hormones affect everything else. So the grumpiness comes from the body just feeling tired. It just feels fatigue. It just feels, I don't want to do this. Like, why are you forcing me? It's just everywhere. But for men, they'll be like, oh, men are logical. Yeah, because you don't have estrogen. You don't have enough estrogen to make you illogical. Let's give you some estrogen.
Let's see
Let's see how you handle it.
Yes, exactly. So, and I always say that God gave uteruses to the people that are strong, because what you guys go through, nah, not me. I wouldn't survive. Probably like just.
So how do I make that difference between having a normal period, like a normal moody period, and like realizing that no, now I need like medical help? Like
Okay.
this
Like
is more
what's
than
normal?
just
Yes, that's a
Okay.
good question. What should I be able to take, and when should I be running to your office?
Okay, cool. So
your office.
my office. So with periods, usually we say that between, others will say 23. So between 23, 25 to about 30 days, 30, 32 days is considered normal.
Of bleeding.
No.
Like cycle.
The cycle should be that
Okay,
long.
yo.
Yes, the cycle should be that long. The period of bleeding should not be more than 7 days. If it's more than 7 days, get worried. But if it's for you, that's normal. It might just be normal. Because then it gives you a few days to actually relax. Because then 8 days is quite a lot. Because we consider it to be 28 days in total. So it means you only have 3 weeks of having a normal life. And then the 1 week becomes very difficult. Yeah. So anything above that, consider it abnormal.
Okay.
Or if let's say, for example, so greater than 7 days, more than 35 days, okay, more than 35
cycle.
days, yeah, just consider that normal. Something that is irregular, yes?
I wanted to ask, so I know for some people, like specifically young people, right?
Mhm.
You never really know how to count your period days.
That's so true.
So you'd
Okay.
find, I know like when I had the IUD, right? The first 2 days would be for spotting.
Mm-hmm. Mm-hmm.
Then I'll have 4 days of bleeding.
Mhm.
And then I'll have, I think, 2 days of spotting.
Yeah.
So we start counting when the first drop starts.
The spotting.
Yes,
Really?
Okay.
that's the first. Because that's the first sign. So you know the shedding has already started.
Okay.
It's the first day of shedding. You count that as day 1.
I've been feeding my period tracker the wrong
Me
information.
too,
then.
because I start when the flow
No,
starts.
because then if your cycle is normal like that,
Mhm.
the days will just coincide either way.
Okay.
So when the heavy flow starts, your days will coincide. Others will tell you, I'm having cramps. And I know that when I have cramps 2 days before, then my period will start. For others, they'll say, I'm spotting now. They'll know my period is, my actual heavy flow is about to start.
But we count the spotting as
Count
day
the-
one
yes, as day
of
one.
the cycle.
So how about the spotting for the last 2 days? Do we also count those?
Yes.
Oh.
Okay.
So how do I count the cycle now? Like,
So the cycle is counted in. So the first day is also considered your last day. So let's say, for example, so this is the first day, you've started your period today. 28 days later, you start again. So that will be the last day and the first day.
okay.
And then ovulation takes place 14 days before before the period, before the shedding starts. Then you know, okay, this is,
Okay. Good.
I have to go and redo my period cycle.
You
It's like the tracker.
You need to go speak to your tracker.
Yeah.
because as well, you have to look at the same. So other women will have, so when we say safe days do not exist.
I was going to ask
That's
about
true.
that.
They don't.
I believe they do.
Safe days.
Remember, sperms can stay in your body up to 5 days.
So safe days do not exist in inverted commas. So in quotation. So safe days do not exist, but they also do exist. Okay. So for example, Can you get pregnant over your period? Yes. Can you not get pregnant over your period? Yes, as well. But there are other women who only produce. So this is coming from where they produce one egg in one cycle. That's normal. There are those that produce more than one egg
at different times
in the same cycle. Yes.
And those not the ones who end up having twins.
Yes. Fraternal twins are like that. Fraternal twins come from 2 different eggs and can be 2 different ages, can be from 2 different fathers.
You mean those 2 different eggs can come on different days?
They can come
I've
on
always
different
thought
days.
it's the 2 different eggs
Me too,
on the day
on
that
the
you
same
were
day,
ovulating.
No.
So you
Can
could
come.
get pregnant today and get pregnant after 2
2
days.
weeks. After 2 weeks.
More
The
things
different
more
fathers
things to
part.
fear.
Ish.
And the different fathers part.
So
Hey.
we say that. So let's say so that's
How many people are raising children that are not theirs?
so
That's
that-
okay.
so usually the idea is one ovary produces 1 egg
Mhm.
every cycle. There are those women that will tell you, oh, I've had 3 sets of twins.
Mm.
And others, they'll tell you they are fraternal. So with the fraternal ones, what happens is 1 egg is producing. It might be the same egg producing twice in the cycle. Or 1 egg is producing this side, the other egg
And
is
the other,
producing.
yeah.
So she'll get pregnant. And because she's pregnant, because she's pregnant now, okay, so that one will start growing. And then if at all she produces another one in the cycle and they don't know that they're pregnant, they can still have another one.
Mm.
Just
Honestly.
honest.
Gosh.
Honestly.
Okay. I've always
And
thought
then
it's at the same
identical
time.
is-
Something
So
new.
identical, same egg, then they
They
multiply
just-
and then divide.
Just do their own thing.
Oh,
Yes.
Okay.
Okay.
So, what steps should somebody take, like, when they feel like there's something wrong with their cycle? Because Anne said she had to go through so many doctors. Like, what exactly should be done if you feel in your heart and soul and body that there's definitely something wrong with me?
Yes, but also, who should I be asking for when I
Yeah.
go to the hospital?
Mhm.
What should I be saying? Sometimes
Mhm.
I feel like we say the wrong. I don't know if doctors just want to misunderstand us, or we are saying the wrong thing when
Goes
you're
to the wrong
explaining
doctor.
what is wrong.
Yeah.
Because I could swear I'm dying, but then when I walk in this office and I say 2 things, I'm not even done. That consultation is done.
Done. No, I think for me, I remember like what was pissing me off is that I couldn't walk without fainting, right? Or just feeling like I wanted to die.
Mm.
And every time they just go back and do a BP profile. What if I die? Give me medicine. What if I die?
Yeah.
No, just go back and I'm like, it literally took everything for me to come here because what even led me to the hospital is that I would get in a yango and feel faint. And I would even be texting Tendai. I'm like, I think this yango has sprayed something, is trying to kill me and kidnap me. When in actual fact, it's just like my beef. And then I would eat. I was like, haha, I was just
I was
hungry.
just hungry. My sugar levels
There
were
was,
low.
yeah. Then tomorrow, after I've eaten, I feel like fainting. And sometimes like you legitimately, and for women's bodies, you don't know. Because me, like, until I had seen that female doctor, everybody else just thought high blood pressure, stress from work. That's what everybody kept saying. Like, high blood pressure, you've gained too much weight. You've what? Just that one doctor, literally 5 seconds with her, she was like, go to a gynecologist.
And it's also, Arthur, the way the system works is that normally you have to go to a clinic, right?
Yes.
You're discouraged in essence with how the system works.
Yes.
You're discouraged from going to the hospital first, right? But if I'm walking into a clinic, right, and I'll find what do you call? I was gonna say family doctor because I know what do you call?
gynecologist.
Not gynecologist. You're not going to find that at a clinic. Like
Clinical officers.
not clinical officers, but the doctors who are
the
just
medical licentiate,
who are
just a
just
general doctor.
So
General
you find
practitioner, yes.
most of the times it's a clinical officer, but these days you also find we do find general doctors, and then they just won't treat it with the seriousness. I don't know if it comes with also specializing, so you're a bit more alert, but because of the way the Zambian system works, you start with a clinic, and I feel like a lot of these issues are not being escalated. Like, I'm not getting a referral because I went to tell the clinical officer that I've not had my period for this and this number of days, or I'm having really terrible cramps. They are giving me medication and they're sending me home.
Yeah.
They are rarely, unless I insist. And then it's a few women who are going to just say, give me a referral, because we know how that can go. They're like,
Yes.
no, you don't need it. Okay, come back after 3 weeks. Then if you really need it. So there's also that system that doesn't work really well for identifying these sorts of issues.
Yeah, that's actually correct, and probably I'll be crucified by my colleagues. But with more experience comes better sense of knowing what you're dealing with.
Yeah.
So as it is now, in the field that I'm more inclined to women's health, and that gives me better perspective, better experience versus if I was dealing with a child. Because if I'm dealing with a pediatric patient now, I'm just like, what am I going to do with this baby? Like, I know I'm a doctor, but okay, this is a long time since I dealt with such.
Yeah.
So usually most of the ones that from the centers that are not specialized, they have that problem. Because like they were telling her, do a BP profile, go and do an echo.
Yeah.
This is a doctor that's thinking of, oh, this is a heart condition. Yeah. And not a specialized one who is like, oh, I know what this is.
Yeah.
You can do
So
this and
what
do that.
should the women be saying, or what should I essentially be asking for? What information, like Hazel was saying, what do I need when I do say, okay, last 2 months it's been 10 days or 12 days of my period. Of course they're okay. It's not so much pain, but I think there's something wrong. And then I'm walking into a clinic, essentially, for example, or I'm walking into maybe even Levy, but
Yes.
the first point of contact is mostly with a general doctor, unless you're saying, I want to. Yeah.
Okay. So usually what we do now is we have units. So with clinics, it's different. With clinics, they do with everyone, and usually they don't want to write referrals, and there's all of that. Yeah. But when you go into a hospital, usually there's departments. Okay. And you say, I need to see anyone in the gynecological team because I'm having these symptoms. Or they'll triage you and say, okay, what are your symptoms? And you say, okay, I'm having this, and that. And they'll take you
Triage?
to triage is to send people, depending on what symptoms they have, to their own place where they're supposed to go. So if you bring a child, they'll tell you, oh no, you're going to the pediatrics unit. They've triaged you there. Oh no, I'm having high blood pressure. Okay, you
Let's
are
find
going
out
to
with
the...
doctors.
Honestly, by the end
to
of this
see a
podcast.
gynecologist. Am I
No,
doing
no,
it
no,
when
no.
I'm registering?
No, so if you want, if you know that I just need to see a gynecologist, they'll help you. But usually by their symptoms, you tell them, okay, I have been having excessive bleeding. I need help. They know where to take you from there. Yeah. So usually at the hospital, that's what happens. In a clinic setup, not really.
It's may God be with you.
No, it's not may God be with you. This is why we designed the app.
Mm-hmm.
Yes.
Real.
Yes.
Very real.
Because the essence of the way we designed it is that we know you can go online and there'll be a bunch of you don't even know where to start. AI face is telling you you're dying tomorrow. There's this and that and that and that. And the way we just designed it is the way, it's your first stop for information, You go through okay, uterine diseases, what is this? Menstrual health. I haven't had my periods. And so you're reading through this information, sort of just guide you, right? Then if your answers are not there, we have that low-key stressed session where you click and just say, listen, this is what I'm going through. This is what's happening. This and this and this and this and that. And then we have amazing doctors like Arthur who get to look through it and be like, okay, so the possibility is this and this and that. We're not saying that we're diagnosing you or doing what, but we're helping you just narrow down what you might have and where exactly you might go and get help from. So when you look through our registry, you're able to see that, oh, there's this clinic that deals specifically with this type of issues, and they have doctors and they have youth-friendly services, just so that to make it easier for people. Because I can imagine me, I was on beefy medication. But all I needed to do was be in the gym and eating brown bread.
Yeah.
Yeah.
So what other conditions are there? You talked about PCOS and fibroids, but what else is common?
Endometriosis is very common. You have also, like we said, so PMS is actually, it's an actual thing. Yes. So it's like premenstrual dysmorphic disorder. It's an actual thing.
Yeah.
So it's because of the hormones. So that is very, very common. So you definitely have to look out for that. Yeah. But those are the ones that are usually
the main ones.
Yeah, usually the symptomatic ones. It's those ones.
I've heard of PID.
It's the one he's talking
yeah.
about.
Oh no, so
No, that's PMDD.
Oh, PMDD. Which one have you heard of?
Yes.
so pelvic inflammatory
Yes.
Oh,
disease.
okay.
This is a disease which is caused by infection from the vaginal canal. It goes up to the cervix, the uterus, and the ovaries. This is an infection of the pelvic organs for a woman. Yeah. So these ones are okay. They are considered sexually transmitted, but they're not
Okay.
like so it can be result of bacterial infection, for example.
Okay.
So these ones are really severe. So we treat them. These ones are treated
Okay.
out of the
Really
hospital.
severe.
Yes, really severe.
I felt like I was dying. I was screaming in that clinic.
They're really severe. So when they do get to that point,
Mm-hmm.
then it has, because usually the symptoms, I don't think that the symptoms just started just on that day.
They actually did.
Just that
I was
day.
just lying
my
down and I
word.
felt a sharp pain in my stomach. I was like, oh, that's interesting. And then it intensified so badly, I couldn't even walk. Like, I couldn't walk straight. I had to bend the whole way to the car. And when I got out of the car, I could not walk at all. They had to put me on like a wheelchair. And then like they gave me like diclofenac, I think, like a bunch of injections, like painkillers. It was so crazy because it just started like that.
And it was PID.
Yes, I had no other symptoms at all. I was fine. I was happy. We were making fries. And then I sat down and a sharp pain. And that was all I felt before it got worse.
So you see, right now I'm feeling pain. I'm like, is that it? Then I remembered I'm on my period. So.
Oh.
So all the time. So I'd encourage women to just every single time,
Mhm.
and even the men, okay, every single time, get tests done.
Mhm.
Testing for HIV, for example, or does not equate to infidelity. Or testing for an STI does not equate infidelity.
Yeah.
Because we're talking about STIs that are transmitted just by body fluids. Okay, you're seated in a bus going to Kamwala, someone coughs on you, they have herpes, suddenly you also have herpes. So that needs to be checked, right? Yeah.
Scary word, hey?
Yeah, that's why I'm surprised that after COVID, people are still kissing. People still
Don't judge, Dr.
Don't judge a
Arthur.
person.
Don't judge a person.
You know what? On judging, I have one last question. It's about STIs and the stigma that surrounds it.
Mhm.
My question is, do you feel like, this is for the whole group, by the way, do you feel like there's still stigma? And if not, why? Because should we be shaming people?
should be-
Why do you have an STI? Why are you having unprotected sex? So should we be feeling like that? Or is it like something we should be understanding? Like, oh no, it's just an STI.
So I think the shaming part comes in you are being an yes. It's the infidelity that brings because for example, right? So if I'm seeing someone and she didn't have it before and I didn't have it before, now she has it and I'm the only partner.
I see what you
Get you.
There's nowhere else she's getting it but from me.
Yeah.
So then I'm the problem. So then it's not just, so the stigma comes in with the fact that it's not just the idea that you have it. It's also the idea that your partner is probably seeing someone else. That comes with shame, right? Yeah. And then now you have to also deal with the fact that you have to bring your partner, because we do contact tracing.
Do people do contact tracing in Zambia? I've
We
always
do
wondered.
contact
Do people?
tracing.
They
We
treat
do.
themselves
You do?
and move
Yes.
on.
So we will tell you to bring your partner and tell your partner
To bring,
to bring
their
their partners and tell that partner to
partner.
bring another partner.
Let's go.
So it's a whole chain. So we always have contact tracing and we do that.
Do they go there at
Do
the same
people
time?
It's the people that just don't want to go.
I was about
but we
to
follow,
say,
but
yeah.
we follow.
You do, eh?
Yes, we do follow, because there's some times when it's like, oh, this woman is pregnant. And the first time she tests for syphilis, she doesn't
She
have.
was okay.
She's okay. She comes back 4 months later for her antenatal review. She has it.
Oh, you taste again?
Yes, we do. We do multiple
To make
tests.
sure the baby's
people-
okay.
Yes, it's for the baby, not for the mom.
Oh.
Because now we're testing for the
I'm
baby.
glad you do. I only did it once when I was
Why?
pregnant. It's the hospital. It's not me.
You've never seen on the card there's like multiple portions. You're supposed to do it more than once. So at least a minimum of 2 times, unless you're pregnant.
It's a good thing if
Yeah,
that's.
so you
That's a good
test.
thing.
Yeah.
You test again. Because then if you are, because obviously we know that women will not be going out of their relationship while it's pregnant most of the time.
This was caught with that pasta.
Most of the time. So it's usually the men. I don't know whether they get bored or I don't know, but yes. So that's the reason why we always test and we tell them to bring their partners. And most of the times we always just encourage them to say, come with your partner. You'll be first in line. Because usually that's what we do.
Oh, really?
It annoys me.
Yes.
That's interesting.
Annoys me.
So everybody who comes with their partner, even if it's...
That annoys me.
So it doesn't have to be a partner.
I mean,
It can be
I'm ready
can
to
be
fight
a support
people
male.
about that.
Oh, really?
Just
Yes.
a male?
Yes.
Yes, a support
Just
male.
anyone.
This is
We
what we're
encourage.
talking about, gender inequality.
You know, because if it's like if I'm carrying Anita, there's no one who's making me jump the line if she's there to support me.
No, she's...
But I do get how it started in the essence that they were trying to encourage partners. But what it has evolved into, I do not like to witness that. It has like its good side.
Yeah.
Because people are encouraged because when they're thinking, oh, I'm going, I won't have to wait a long time. But we also we're treating the men as if they're doing the women a favor.
Yeah.
By going to get tested together. But I get how when it started, like it really did do its trick because you do see them and you do see women force their men to come with them just on the basis that they do not want to be in that queue for a long time. But then we know how the dynamics are in Zambia and how many single mothers are there, but also how many women are having to they just want to have a baby on their own.
Yeah.
So it does... I did one visit at a local clinic when I was having my child. I did one. And by the time I was leaving, I had fought with everyone in that clinic and I left. I said, I'm never coming back. Goodbye. I'm going to a private hospital because by the time it's 9 months, I'm bending this to the ground because everywhere I looked, there was something. I was like, don't speak to this girl like this because where's the father to your child? And this young girl was like, no, he's not. There's no child that doesn't have a father. Is it baby Jesus? I'm like, madam. So of course I get like what they're trying to do and what they're trying to encourage, and it does help because I did see some men. But then also there are some women who just go to taxi rank, like the taxi drivers made like a business, so the women would like pay them to go.
Get that bag.
To go with them to like get to jump queues. But I do get that, especially when like now that you've mentioned that you actually do retesting and you know the reoccurrence. Because I think then they were just testing at the first, because way back then we're not even doing antenatal every month. We're doing antenatal. So when you do it today, and you don't do it in the first month. So you only start antenatal at month 3. Then yes, when you go today and they say 1 month, they'll tell you, okay, we'll see you in 2 months to start. So when you start month 3, you will go back at month 5. Then you go back. It was just about 4 visits. Then you go back again after 2 months. Then at the end, you do like 2 more visits or 3 more. But then I heard, like just after a few years, I heard, oh, okay, it's now changed. It's now every month. But then if you're doing it from a private hospital, it was every month then. Yeah, so it does evolve, I think, with when they see things happening and things that they miss. Now, apparently, it's as soon as you find out. Then it was,
soon as you
what
find
are you doing here? 1 month. Come at month 3.
Now it's as soon as you start, because there are women that will tell you I've been pregnant maybe 3 times and maybe this is my 4th pregnancy. I've not had a child prior, and I was having my what's this? Well, then you ask why weren't you coming? Like where are the other antenatal cards? I'll tell you no. I was told I have to start after 3 months, and the pregnancy is out by the time that 3 months is starting. So there's no need for me to start. So that's how come now we test. If you know, just immediately you miss your period, just come. Yeah.
Guess who's not coming?
They'll not see you.
No.
Yeah, but also talking about like the shame and the stigma around STIs. I also feel like, of course, so I'm going to say, of course, the system doesn't want people to be sexually liberated. So, like the basis of someone getting an STI, people just think if you have too many partners.
Mm.
Well, even if I do have too many partners, it's
Oh,
still
wow.
fine. But I think the stigma also stems from that, from the fact that most of the times when you're thinking STIs, you're thinking there's more than one partner. But there are people who are not exclusively dating. There are people who are not even dating, who are engaging in sex. So I feel like that sort of, it stems from that, and it keeps people, even though someone knows I'm not dating anyone, I've been having sex with different people. But because of that shame, they'll feel like they fit in the box of where they were supposed to just stick to one person, even though that doesn't work for them in that time and in that space. But also, I think the fact that STIs can be treated should also be should also be a thing of like that should encourage people. Like, oh, okay, it's like how hard malaria was years back and how a bit easier it is now. And I think it's the same with STIs.
STIs don't kill.
Oh, they don't?
By that, no, they don't kill. STIs don't kill.
You won't die.
No, you won't die. And usually they're treated out of office.
Mm.
Yeah. So you're treated out of office. They don't kill. Now the laws are kind of stringent on privacy. Yes. So it's a big thing. So you go to the hospital, this person starts saying, oh, this person.
Even in a town like Mazabuka.
Okay, yes, especially in a place like Mazabuka.
I can imagine
because I'm coming from a small town. I know how word can get around.
Yeah.
Yes. So like, there's like, I have always said that in small town, it's a constant, as a doctor, it's a continuous episode of we listen, we don't judge. Because these are people that you go to church with.
Yeah.
These are people you go to church with. These are people. So it's like, oh, Dr. Chumba, how are you? I'm okay. How are you? It's like, I don't know you. And that's the reason why I avoid people calling me Dr. Chumba in public. Because then it just makes other people feel, oh, so they know he's a doctor.
I wouldn't know if they said Dr. Chumba. I'd be like, no, I don't know. I don't know Dr. Chumba. Dr. Chumba.
Ask what Tezo calls him.
Yeah.
So it's usually when they come to the hospital, like, oh, okay. But then when they see me, they're like, hi, how are you? Yeah.
Okay. Anyway, guys, this was actually very informative, and I really hope like young people who will be listening are able to get the answers that they need. Able just to feel safe to know that they're doctors, like Dr. Chomba.
Arthur.
Yes, thank you. Someone calls me Arthur.
But also, I hope that what this conversation has done is give you some questions that you can then go and check out on the app, but also ask your doctors, and also just give you like the language that you need to put into words what you're feeling.
Yeah. I feel like the body can sometimes be very scary, specifically when you feel something is wrong. You're like, I don't want this to be wrong. I don't want anything bad, so I'm just going to ignore it, right? And it's like, for example, I learned just like this last week through TikTok that when you ignore UTIs for a long time, they give you sepsis.
Yes.
And I'm like, what? Like, stop drinking cranberry juice and just thinking, I'm going to be good.
Especially that cranberry juice. That's why it's selling out. I can't find cranberry juice in ShopRite. Go to the hospital.
No, like, of course, cranberry juice is good, but it's not.
But yeah.
So with UTIs, they're common.
Yeah.
Common and most common in women, right?
Yeah.
They're not sexually transmitted. Okay, they are. Okay, sometimes they are, yes. Because obviously there's sweat involved. There's bacteria moving from one portion to another. That's expected. But we don't count them as an STI.
Yeah.
Right? But they're very common in women because, first of all, their urethra is small in comparison to men's. It's very short. The trips to the bathroom always have wiping involved. That tissue is just seated there. Yeah, it's just seated there. So there's things. Yes. So it's
what's good? Give me something else to worry about.
Yeah, so they're quite common. So it's something that's common that needs to be checked every so often. Get a urine test every so often. That's just normal.
Yeah. Like, the moment you just start to even feel it, and for some people they might not know, specifically like young people, that intense need to constantly pee, that pain you feel, just go to the hospital.
Yeah, sometimes it's not an STI, but go to the hospital.
Yeah, it could be a UTI. And also, like for some people who are starting to have sex, always pee immediately after sex.
Yes.
Just
Especially
always
that.
pee. Like, don't even lie down. No, just go straight and pee.
Before you cuddle.
And this
Yeah.
goes out to both.
Men and
Male.
women.
Mm.
Yeah, go pee. But yeah, everybody, thank you so much for being here. This is great. We hope you'll be back.
Yeah.
And yeah, I hope everybody has a fantastic week.
Thank you.
Bye-bye.
Thank you.
And thank you to Arthur for teaching us what triage and spermatozoa means.
HCG.